of you has any questions, please keep it. Write it down, and then we will discuss that during the end of this session. So without further ado, let me introduce our first speaker, Dr. Toshibumi Taniguchi, or Dr. Tosh. Yes, you can go to the podium. Dr. Toshibumi is an infectious disease doctor. He's an associate professor of medicine at the Department of Infectious Disease at Chiba University Hospital. And since 2017, he has been the PI and co-investigators in PrEP program among MSM in Japan, and as well as the community-based HIV care program in Chiba Prefecture in Japan. He will talk about the overview of PrEP implementation models. So please welcome Dr. Tosh.
Well, first of all, thank you very much for inviting me to this wonderful symposium. So my name is Tosh Taniguchi. I think I'm new to this symposium. I'm from Japan, and in my country, we still don't have PrEP yet. And all we have is a small demonstration project which enrolls only about 100 people. So I really don't consider myself a PrEP expert. What I have done for the past 3 years is preparation to implement PrEP in Japan. So I have visited countries with advanced PrEP implementation programs and had a nice discussion. So today I'm going to talk about the overview of various PrEP implementation programs. So this is my disclosure, and this project is funded by the Japanese government. So talking about PrEP in the world, there's about 68 countries listed in the PrEP Watch website, which are some sort of PrEP program. So while Japan is way behind from most of the successful programs in the world, there are things that we could learn. For the audience here who are from cities or countries without PrEP program or just starting, I think we could learn from these advanced programs how to practically implement PrEP. So this is what I really want to emphasize. PrEP is much more than just prescribing Truvada or its generic. So if I have to summarize what PrEP is all about, I would say that PrEP is to talk about sexual health and provide an option for HIV prevention. So it seems so easy to distribute Truvada to people with risky behaviors, but it's not that simple. So PrEP is not just giving Truvada. I want to detail this furthermore during my talk. If you go to the WHO website, implementation tool for PrEP is available. So I'm going to talk about the real aspect of PrEP implementation models. So let's take a look at the actual implementation strategies. So things that you have to consider before implementing PrEP is to decide who is the target, who is providing the service, the location to provide the service, and the funding, who is paying for it, and the availability of generics. And PrEP clinic will be different depending on the target population. Is your city having problem with high incidence of HIV in the MSM, trans or bisexual or commercial sex worker? Most cities would be a combination of these people. Those people would be the main target for PrEP. So this is the list of who the service is provided, and it really depends on each country's policies. Is it going to be physician-led, nurse-led, key population-led, pharmacist-led, or the places where the access is a problem, telemedicine could be another choice. The most successful programs seems to have a nurse-led clinic, but not all the cities or countries could do that from various reasons. like regulations that only a doctor can write a prescription or lab tech is required for testing, and etc. And this is a models to provide sexual health. VCT, voluntary counseling testing, STD clinic, or could it be a hospital-based clinic, community-based clinic, could also be a private clinic. And also, if you don't have access to all of these, it could be your primary care physician who could provide PrEP. So which is the best model to provide this service? The most successful programs have their clinic in the middle of the community, which has been functioning as a community center for STD clinics. Not all the cities have STD clinics, and we have a big problem of how to implement PrEP outside the big cities. PrEP does come along with NPEP, non-occupational post-exposure prophylaxis. So availability to antiretrovirals may be necessary. In that case, HIV clinic or hospital-based clinic may function as PrEP clinic. So let's start looking at the actual models. So this is Taipei City Hospital in Taiwan. It is a hospital-based clinic. It's located in a big, busy, chaotic hospital. And it functions as STD clinic. They started to provide on-demand PrEP. So Taiwan is running a demonstration project at this moment, but what I'm going to show you is outside of the demonstration project. So they made a 8-pill package of Truvada for on-demand PrEP and distributing it with the financial support from the local health department. You don't really need a fancy clinic to start PrEP, and I think utilizing the function of STD clinic is good enough as long as the clinic is accessible and the local people know where to get their sexual health services. And this is a fancy-looking clinic in Kaohsiung in Taiwan. It's called HERO Clinic. So HERO stands for Healing, Empowerment, Recovery of Chemsex. And this is a hospital-based sexual health clinic, which is physician-led, and it's located inside Kaohsiung Municipal Minsei Hospital. So as you could see, this is a clinic focused on chemsex and sexual health service. This has an ongoing program outside the demonstration project funded by the local health department and the hospital which this clinic is located at. So the target of this clinic is not limited to MSM or transgender, but also involves IV drug users. They provide harm reduction for them. So this place is extremely welcoming. And remember, this is located inside a chaotic city hospital, which could be very busy. So next, I'm showing you the famous Dean Street Clinic. So 56 Dean Street functions as STD HIV clinic where doctors provide care. So less than a minute walk, there's Dean Street Express, which provides sexual health services led by nurses, and they are without doctors. By doing so, they provide sexual health service to a lot of people. It's about 12,500 clients per month. So most PrEP screening are done here at the Express. And the complicated cases, such as clients with renal dysfunction, goes to the PrEP clinic at the 56 Dean Street. So let's watch a video showing how things work at the Dean Street Express. So a client walks into the Dean Street Express and tell that they want the PrEP. Gives you a swab to check for rectal and pharyngeal gonococcus and chlamydia. They go up into the bathroom. They put the sample in a shooter and the sample is processed really immediately, and they get the result of GC chlamydia in about like 90 minutes. And the client waits, and he's a nurse, and he calls him in, gives counseling about sexual health, and also draws some blood to check for HIV. And also check if the client is indicated for PrEP. The clients get the results by the text messages, and the physician at 56 Dean Street checks the lab and get the permission for PrEP. So the client walks into the 56 Dean Street PrEP shop and actually receive the medication. Okay, so this is a model for sexual health clinic in many countries. It's really fancy. High burden of clients wanting STI testing led to the opening of nurse-led Dean Street Express. And generic Truvada could be purchased online as well as at the PrEP shop at 56 Dean Street Clinic. The test results are electronically sent to the NHS medical record, and the doctors monitor the lab at 56 Dean Street behind the scene. And on-demand PrEP or daily PrEP, depending on their risk behaviors. I'm going to show you another very good model. And this is in Melbourne, Australia. So Sydney is a model famous for successful nurse-led PrEP. But let's look at the model in Melbourne. So this is a STD clinic located close to the gay community. PrEP clinic is basically physician-led, and they recommend daily PrEP. They also have a express service, which they call Test and Go, TAG, which is nurse-led, and providing express STI, HIV testing. And HIV clinic and STD clinic is in the same building. Yeah, and PEP is provided. Rapid ART is not provided here. Let's go to San Francisco. They have this place called Magnet, also called a Strut, which is a sexual health clinic which stems from a community center to support MSM and those with HIV in the middle of gay community, which is called Castro District. So it basically functions the same as Dean Street Clinic, except for the fact that PrEP is covered by health insurance in the United States. So they have a multidisciplinary team involving social workers and nurses called PrEP Navigators to make sure that everybody gets PrEP with no copay. So they provide all the sexual health services, including NPEP and same-day ART. So San Francisco is a city with rapid declining HIV incident rate. So I believe this is due to the combination of testing and rapid ART and PrEP. So PrEP is offered through insurance or Gilead's assistance program. So Magnet is run by San Francisco AIDS Foundation, which also runs few other clinics in San Francisco, which provides different strategies depending on the target. So Tenderloin is a district with a lot of poverty and IV drug users. So they have a clinic focusing on harm reduction and nurse-led hepatitis C treatment, along with the HIV-related services. So this is Thai Red Cross. I don't really have to mention too much about it because I think they're gonna talk about it after me. But I believe this is a very successful for providing sexual health services to high-risk population. And I believe this clinic stems from BCT. And this is the Swing, key population-led PrEP, which has a lot of potential. And I'm so jealous that Thailand is able to implement such model. And I believe this is a model which point-of-care testing and distributing PrEP is all organized by the key population and does not necessarily have doctors at the location. However, this strong model may not be applicable in many countries because of the availability of, because they may have like rigid regulation in terms of prescribing and testing. This is Pulse Clinic, which is also from Bangkok, which is a private clinic, physician-led, which is becoming a great model for clients wanting good service with higher price. And in Tokyo, actually, people are trying to make a similar sexual health clinic, which is 100% fee-based. So for a successful PrEP program, PrEP should be included in the national guideline. Also, availability of generic Truvada or Descovy is the key to success. And brand is too expensive in many countries, which limits the usage of PrEP to those who really need it. So I know Thailand at this moment has no problem with this, but I believe many countries is still having trouble with the availability of generic. So we could import the generic, but countries like Japan has restriction where a client cannot import PrEP for more than 1 month. And also the testing. PrEP comes along with HIV, STI testing as well as renal function tests. So the issue is who is paying for all of these tests? Free testing will increase the number of people tested. So if the insurance or the government is paying for the money, that's fine, but you have to always think about the sustainability of the program. So what could we learn from the PrEP services around the world? So I think it is important to increase the literacy of sexual health and make them responsible for their own health. At PrEP clinic, what kind of sexual health service is required? So I think point-of-care testing is extremely important. I think NPEP and ideally same-day RT should be combined as well. Sexual health clinic is a good place to provide vaccination such as hepatitis A, B, and HPV. And if you have a lot of clients who's having chemsex or party and play, harm reduction would be required. So best PrEP service model in the rural areas outside the big cities remains unclear. So what if there's no sexual health clinic in the place you live? Who will prescribe PrEP and NPEP? Is it going to be teleprep, pharmacists, primary care physicians? Should you get NPEP from the nearby hospital? We don't really know. So, and also, we have to think who will test for your HIV, STI on a regular basis. KP-led PrEP and HIV, STI testing treatment is a good model, but needs strong political support. And you always have to think, what if there's no place for the community members in that area? So I'd like to sum up, and this is my acknowledgement slide. I want to thank everybody who allowed me to visit the really great programs and showed me around. Thank you very much for listening.